Speech pathologists are university-trained professionals who diagnose and treat people with communication and swallowing disorders. When a patient first comes to see us, we will do an assessment which usually lasts for about an hour. The first thing that we'll do is to take a case history, so we need to get some details about what the patient or the carer or parent perceives are the difficulties. When we're doing this, it's really useful if we can get some information from the GP, some relevant details from the GP, because frequently the GP knows the patient quite well and is able to fill in some of that really important background information. So that helps us to create a more cohesive picture. Now, following the case history, the taking of the case history, we will then conduct a formal assessment, and following that assessment we will give a verbal report back to the patient or the parent. And this is really important because it allows us to explain the benefits of therapy and explain a little bit about what happens in therapy as well. Sometimes in the case of a really young child, it's not possible to do a formal assessment, so the speech pathologist would then engage that child in play and try and gauge an idea of what their receptive language is like informally, and also possibly take a language sample as well.
The range of referrals could include a teacher who's been off work repeatedly with a voice injury, or a person with Parkinson's, for example, whose spouse comes in and says, I can't hear her anymore, I have to ask her to say things 1,000,000 times a day, and the GP may actually perceive a change in voice. So I think GPs are in a really good position to spot those kinds of changes because of their familiarity with the patients. I saw a gentleman last year who was a delightful Spanish fellow who had his stroke, and because he was mobile after the stroke, he was sent home very quickly from a public hospital. And it meant that he didn't have access to the normal rehab services. So the GP actually found me and initiated a referral under an enhanced primary care plan. And I have to say, when the gentleman came to me, he was very distressed because he'd really lost a significant amount of his language. He was really struggling to communicate with his family. And so we were able to assess him and introduce a short block of therapy covered by that plan. And he made excellent gains. So within 3 weeks, he could understand that he had aphasia. He was able to communicate to somebody in a shopping centre what that meant. So, I have aphasia, I understand you, just give me extra time, So it made a very real difference for him in a quality of life.
Our motto is early intervention is the best intervention. So as soon as a child is identified as having a problem, or if a parent expresses concern, it really is definitely worthwhile getting that child assessed. No age is too young, so we see kids from early as 18 months, because even when you look at a newborn baby, there are certain milestones that we expect even in a newborn baby, from the way a baby looks at you, from the way the baby interacts. So there is no such thing as it's too early to get a speech pathology referral, because really the earlier we get them, the earlier we intervene, and really the better the outcome is. So by the time they're 5, we usually find that we're not getting those real severe kids going to school because we've already fixed the problem before they even get there.
It can be more difficult to recognise a child with a language disorder than the other disorders, and that's because children who present with language disorders are good at picking up environmental cues. A good way to try and recognise this a little bit more is to ask more open-ended questions. So with an older child, you may ask them what happened in the last movie that they saw, or how to work the latest computer game. With a younger child, you may ask them what they did on the weekend, or how to tie up their shoelaces. And these sorts of questions are more likely to generate longer, more complicated responses. Children with language disorders frequently will respond with fillers such as stuff, or I don't know, or I don't remember. And this is frequently because they do not have the words to express themselves clearly, so they will respond in a way that does not encourage somebody else to continue the conversation with them.
If the GP thinks that the child is presenting with autism, then refer them to have a language assessment. Usually the speech pathologist is the first port of call, because usually kids with autism would present with delayed language. It's every autistic child that I've ever seen. Now, so as soon as you feel that the child is having a difficulty or presenting with autism, refer them in, because like we said before, early intervention is the best intervention. And just with these days, with all the funding that is available for autism, like FAXIA funding and all the stuff that they can get from the paediatrician in terms of the EPC and the item 135, then it really is important the child gets referred in as soon as possible. Now, with kids with autism, they do manifest with different sets of skills, and that really will depend on where the child's intellectual ability are. So if we get low functioning autistic kids, they will present with the flapping arms or no empathy, but our higher functioning autistic kids don't present with those things, so they can still empathise and they can present with no sensory issues, but it doesn't necessarily mean they don't have autism. So when someone is thinking that the child has autism, it really is important to look at the child as a whole again, and that we contact other professionals or speak to the school or speak to the preschool to see what other behaviours the child is presenting with. Michael presented at the clinic here at about 2 years, probably 18 months of age, I think. He was non-verbal. He was not using any language at all, and I was unable to formally assess his understanding. He responded mainly by banging the filing cabinet with a small hammer. So we set to work working with Michael. He had a very supportive family. Mum and Dad were both regular attenders, and he had a large number of brothers and sisters, about 4 or 5 brothers and sisters. They came in on a regular basis, and they were very, very good at following through any of the strategies that I gave them to work on at home. Over a period of probably 2 to 3 years, Michael's speech and language developed extremely well. It developed to the point where I could assess him and I could get a formal result, and of course the result was severe. After many sessions and a lot of support from Mum and Dad, I did a final assessment on Michael, and his speech and language skills were age appropriate.
So GPs can refer directly to a speech pathologist. Most speech pathologists will accept referral under an enhanced primary care or chronic care plan. Veterans are covered for allied health services, and most private health funds will also support private speech pathology.